We're at the IAS meeting in Kuala Lumpur with Martin Duracinsky, and he is from the Paris Hospital in Paris, France. And the thing you bring to the conference is that you have a quality of life assessment. And I'm going to let you describe, first of all, what is quality of life?
Well, thank you. I'm not going to give a complicated definition what is quality of life, but there are really three important points: that it's measurement of subjective perception of the patient that cannot be replaced but by other factors like biological variables, CD4 or viral load. And secondly, it's a multidimensional concept. It's part what we call of patient-reported outcomes, different outcomes that can be measured during clinical trials, in research, or maybe also in clinical practice. And this quality of life is multidimensional, with at least physical, social, and psychological dimensions. And it's often measured by questionnaires in research.
Mm-hmm. But the one thing that you said was that you did want to make sure that you were able to have some sort of standardization in this with a tool, and that's kind of what you've kind of accomplished.
Yeah. We can always do also qualitative and quantitative work, but for the needs of big cohorts and clinical trials, also practice, we need these standardized tools to be able to for different reasons, to maybe to differentiate different treatment strategies, to evaluate and interventions. And for this, we need standardized tools.
And mostly this is used in not clinical practice, but in research, because it is a part of the research project. They want to see it's an outcome.
Yeah, it's the measurement on quality of life. It's been part mostly for the research and clinical trials. However, maybe to this measurement we didn't give as much as important as to other viral factors like CD4, etc. However, now we are in the situation where all these strategies are rather equivalent or non-inferior in terms of efficacy. Mm-hmm. That's why measurement of this patient perception, symptoms, and quality of life, it becomes really important. Because it really makes a difference, and also in the individual decision for a treatment strategy might bring additional information to the patient and to the clinician.
So you're saying that it may be a tool that not only would we use in research, but we can actually use it in clinical practice to actually guide us in how to change therapy or not.
Yes, the research in patient-reported outcomes is moving to from research in clinical trials to the use of these patient-reported outcomes in clinical practice, because some data can be known only to the patient. Mm-hmm. Doctors, they cannot have asked 25 questions to assess all different dimensions important. Mm-hmm. And it was shown in publication that using the quality of life tools can help patients to have better communication and to identify better the domains where they need some help or they need to discuss. So there were some other chronic disease that the efforts were done to use in clinical practice these patient-reported outcome tools, and we validated a new tool in a clinical research. And I must say also that what was the problem before in this research was that instrument used, they didn't have the treatment dimensions, or they were generic instruments, and they were not able to make real differences between different treatment strategies. So we really try to develop a new tool internationally in different cultural settings and different healthcare system, and we were able to in these different languages and cultures develop a new questionnaire, Procol HIV. And what we were thinking to do also, try to see if we can validate it for a clinical use. If patient fill the questionnaire, we validated the electronic version, and that doctor on his he can see before the consultation some dimensions, saying, okay, here's a problem, and that can have a more targeted discussion with the patient.
So would you use the same exact, other than the language difference, would you use the same tool in any cultural or situation around the world, or is there slight nuances that might make it more appropriate for one ethnicity or one cultural situation than another?
Well, when we started the project, which was done really in 9 countries and 11 languages, the question was, will we really able to have only one instrument, or we will have to do specific dimensions for some country, but using a different methodology, and keeping the concept behind the question. Even the questions got different formulations. We could validate it and to show that it was working in all countries.
The same tool, which is really important in research.
Yeah,
be consistent.
Regarding the dynamic of epidemics, we cannot do what we were doing before, just validate an instrument in one language or Western country, and then it's really difficult to go and to do cultural adaptations.
So where do you go from here? Do you have more, you're going to be developing this for making it for other countries? I mean, you've got to change it into a lot of languages, correct?
Yeah, and well, it was validated in really different countries. So now when we need more languages, what only we do is we call it linguistic validation. So it's several translations and the test of understanding with the patient in different countries. So it was used already in other languages and in other countries.
So you had told me that you're obviously you'd like to get some funding for this, but basically you make it available pretty easily for organizations for research. Is that true?
Yes, of course. It's free for researchers and patient associations. We just they write us and we make a user agreement, and it's very quick.
Well, it's very good of you, and I think the other thing we'd like to do is make sure that we have a way for people to get the information about you. So we'll put that on the website with it. We'll put your website information. Is that good for you?
Thank you.
Okay, good. Well, I appreciate it. Do you have anything else to offer on this as far as moving forward, or did we kind of cover all of the information that's necessary?
I think we covered everything. Maybe one thing to say that this measurement of quality of life is important because the quality of life is not predictable from other factors. We always see low correlation between perceptions of clinicians and perception of patients. So it's really important to measure exactly this perception of the patients. And also there are now guidelines from FDA and from MEA how the pharmaceutical firms who wants to apply for a claim for some dimension in quality of life, there is a whole methodology described how they should do it the correct way.
And how many questions would you say are in this quality of life survey?
In our Procol HIV instrument, there are 39 questions plus 3 questions, and it takes about 5 to 7 minutes to fill in.
Not too much torture.
It's not too much torture comparing to other clinical exams and blood tests.
Yes, yeah. We talked about that earlier.
Yes.
Yeah. Well, thank you very much for your time.
Thank you.
And I look forward to seeing this and maybe even using it.
Thank you.
Thank you so much.
Thank you.